Good afternoon or good morning, depending on where you're joining us from. My name is Alden Landry. I'm the Assistant Dean for Diversity, Inclusion, and Community Partnership here at Harvard Medical School, as well as an Associate Professor in Emergency Medicine at Beth Israel Lahey Medical Center. I want to welcome you to today's webinar. We're going to be discussing ophthalmology residency opportunities at the Harvard-affiliated hospitals. Today's program is part of the Office for Diversity, Inclusion, and Community Partnerships Visiting Clerkship Program. The mission of the DICP is to advance diversity and inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and ensure equity in health locally, nationally, and globally. DICP efforts support the career development of students, trainees, and junior faculty, identify and train leaders in academic medicine and health policy, and provide programs that address crucial pipeline issues. Under this umbrella, the VCP has been a model for excellence, offering outstanding medical students, particularly those coming from groups underrepresented in medicine and those committed to addressing issues of inequities in healthcare, an opportunity to participate in externships at the Harvard-affiliated hospitals and at HMS. Since its beginning in 1991, over 1,600 students have completed the program. As part of our outreach, we host a series of webinars each year to bring members of the HMS residency programs and medical students together to share ideas, provide support, and to address questions on transitioning to the next stage of medical training. These webinars provide an opportunity to discuss the application process, address questions from students regarding away rotations, as well as any other concerns that students may have. This year's webinars will include ophthalmology, orthopedics, urology, and physical medicine and rehab. The dates of the programs, along with the contact information, will be listed on the final slide that we'll show today. Just a couple of housekeeping notes. This webinar is being recorded, and a copy will be sent to all the participants, as well as being posted on the DICP website. The chat function is turned off. However, if you would like to ask a question, please do so in the Q&A section on the bottom of your Zoom. And lastly, a short survey will be posted at the end of the webinar, and we would really appreciate any feedback that you have and taking a brief moment to complete this survey before signing off. Now I'm going to introduce our panelists who are joining us today. Dr. Alice Lorch is a comprehensive ophthalmologist at Massachusetts Eye and Ear, and she is the program director for the Harvard Ophthalmology Residency Program, as well as the Vice Chair of Education and Associate Chief for Education. In addition to her roles in education, Dr. Lorch is also the Chief Quality Officer and Associate Chief for Quality for the Department of Ophthalmology. Her research includes quality reporting, patient-reported outcome measures, and teleophthalmology. She is also the co-PI for the Mass Eye and Ear IRIS Registry Data Analysis Team and directs Mass Eye and Ear Community Diabetic Retinopathy Screenings Program. We also have joining us Dr. Ankur Shah. He is a pediatric ophthalmologist at Boston Children's Hospital and at Massachusetts Eye and Ear, leading the pediatric eye trauma services. He is an assistant professor of ophthalmology, director of medical student and ophthalmology education, and the director of inclusion, diversity, and equity in the Harvard Medical School Department of Ophthalmology. His research interests include pediatric eye injury, efficacy of innovations in medical education, and the use of telehealth to expand access to care. So with this, I'm going to turn it over to Dr. Shah, and he's going to give a brief orientation to the ophthalmology residency program here. Dr. Shah.
Dean Landry, thank you so much for having me, and thank you all for joining us and those watching down the road. So I think to introduce the Harvard residency program, we have to start with our people or our team. And perhaps we could have, so shown here is the resident class of 2026, and we're so proud of them. They've almost made it through internship and will be joining us full time. And they are a great group of people. Our match was recently completed in February of 2023, and it was absolutely wonderful. And if I could have the next set of pictures, this is our group for the residency class of 2027. And we're so excited to have them come soon. Our people is also made up of our leadership team, and the education leadership is shown here, led by Dr. Joan Miller, our chief, and Dr. Alice Lorch and Clifford Kim, our program director and associate program director, and then Dr. Eric Geyer, who's our research director. They lead hundreds of faculty literally in our department that will teach you as a resident here at our program. And I really want to emphasize that this team is just an amazing bunch of professionals. So you would think of them as clinicians and surgeons, but also as mentors and device innovators and all those words that you see in the bottom right corner. But on a more personal level, their parents, their children, partners, athletes, musicians, all those things that they bring to work and make this a community that's absolutely amazing to work in and has been my home for many years now. And is surprisingly my home because I was expecting to be dragged south by my wife. Next slide, please. Our vision in training you as a resident is first and foremost to provide you best-in-class medical and surgical training. That is critical. Our second mission is really to inspire an academic approach to ophthalmology and medicine in general, just by bringing you into this thriving culture that has really just been my home and been amazing to make me better every single day. And then third is really to foster your early career development as a leader in the field. We are here to train you to be that leader in whatever you want to do. It could be clinical medicine, it could be research, it could be industry. To do that, our culture really starts with clinical excellence. And that is through clinics that are run by our faculty, where residents work side by side with those faculty to treat all patients, no matter what background they are, no matter what insurance they have, so that we ensure a level playing field for every patient that walks in the door at Harvard Ophthalmology. And it also involves significant didactics that are shown in the bottom. And then obviously we are a surgical field and surgical excellence. So just like in the clinic, you will be working side by side with your clinician and surgical educators in the operating room, operating on the same patients and being part of that team to drive that care forward. And then it's supplemented by the didactics that are shown in the clinical wet lab in our amazing wet lab space that has been developed with programs that are dedicated to teaching you how to do surgery. And then the last piece of that culture is really resident input and wellness led by Dr. Lorch and Dr. Kim, and really encouraged by Dr. Miller, our chief, in a top-down approach that at every stage, we want residents to give us feedback. And so Dr. Lorch and Dr. Kim hold monthly program director breakfasts where you get to give feedback and they can make on-the-fly changes to the program in areas that may not be working or expand areas that may be working. And at the same time, they provide all the residents with a wellness budget that you guys can use as a group to determine what sort of activities you can do outside of work to really build camaraderie, but also to keep everything fun and keep you coming to work excited to be part of the team. And finally, I'd be remiss to not give our philosophy on how we are dealing with inclusion, diversity, and equity. Unfortunately for ophthalmology, we've been behind the 8 ball in the rest of medicine. And we are trying as a department to be better about this. And so shown here is our philosophy in our program, which we named I Can, if you will. And the idea is really to encourage people in every phase of the academic development, starting in elementary school all the way to faculty, to believe in themselves and to believe that they can do anything at an early age, and then really to sort of get them down to leadership when they get to that level of faculty. And we have specific programs at every level that are going to support you as residents, but that you can also participate in to sort of feed it forward and to feed it backward to those that are coming before and after you. And so hopefully we'll get a chance to talk a little bit about that, but I think this is an important stage in ophthalmology where we hopefully can change sort of the climate and the number of people that are in our field that come from varying backgrounds. So with that, I will end, come join our team. And I think the last slide just shows that we are truly a Harvard Ophthalmology department with training at all of our Harvard institutions. Thank you.
Thank you for that introduction and helping us just to get a global understanding of your approach and your philosophy around education. And I think all of those watching and listening really got a better understanding of what it meant to be an ophthalmologist trained at Harvard. I really want to dive into a couple batches of questions. We're going to talk about different aspects of the application process, We're going to talk about letters of recommendation and personal statements and so on. But I really want to focus in on a general question, which is, what are your overall thoughts about this application season? Is there anything that's going to be different from this application season compared to years prior? And what are you doing to prepare for this application season?
Great. There are a couple different changes. So ophthalmology, for those that don't know, are in the is a match within the SF match system. So that is different from most of the residency programs that your classmates are going to be going through. So that's the first thing. You need to get to the SF match website because that's where it's going to be. And on that website, there is a ton of information and even webinars about how to approach the match. I think the biggest change that we have seen from last year to this year is elimination of the Altus suite. So the Altus suite was a set of tests and interviews that were done to sort of gauge situational awareness and to record a quick, like sort of 2-minute bio about yourself so that you could sell yourself to these different residency programs. And it was rolled out last year very quickly. And I think that it was rolled back this year based on feedback that we didn't really know how to use it and how to prepare our students to excel at it. And so I think that's the biggest thing that you're going to see between last year and this year. So if you talk to your upperclassmen, just know that the Altus suite is no longer part of the system. The rest of the application should roughly be the same. I'll give you a very brief overview of when we're going to be starting. So usually around July 1st is when you register with the SF Match and you can start downloading the application. We advise our students here to start in July and August to putting together your autobiographical sketch and then these short answer essays that we can go into down the road. Those are due by the end of August, and we really advise you to get those applications in by the 3rd week because they will be released to programs on September 1st. Between September 1st and about October 18th or 19th, programs have time to review those applications and offer interviews to those individuals that are going to be interviewed at those programs. And then October 18th is when you will start getting invitations to come and sign up for an interview. Those interviews will occur through December of 2023. And then we as a program will submit our match list in the 1st week of January, and we are locked in. You then have approximately 2 weeks to go visit those programs that are on the top of your list. And that was the brainchild of Alice Lorch, who just joined us. And it's basically an open house where you can come to our program and all the programs across the country and interview us and ask us those tough questions that you might not ask because the stakes are not very high. We're locked in to what we've ranked you as, and you're not locked in. So it's our opportunity to sell you the program and your opportunity to ask the tough questions. And then you put your residency rank list in at the end of January, and matches are around the 1st week of February.
Thank you. I think that was really helpful. And one of the things that I think is really important for students to know is that for you all as leaders within residency programs, as well as in other specialties, we are at the will of others when it comes to the bigger decisions that are made when it comes to the application. And we don't necessarily always have control. So you mentioned that something was started last year, then disappeared already. That happens, and we as programs have to roll with the punches just like the trainees or the students do as well. And we try and be supportive and accommodating, and we are all learning as we go through this process. Dr. Lorch, thank you for joining us. I just wanted to ask you a question as someone who's interacted with medical students, probably mentoring students around the country, as well as here at Harvard Medical School. Are there any concerns that students are expressing about this upcoming application cycle that you're hearing more commonly?
Thanks for having me, and I apologize for being late. I was down in our emergency room, which is one of our draws and kind of most interesting educational experiences in our program. So I was down there with our residents. I think that this every year the application cycle changes a little bit, which I heard Encore mentioning. So I think some of that uncertainty is what I hear a lot about. And people often asking questions about what to focus on now, what's the most important part of their application. One of the really, I think, meaningful parts of the way things have changed in the last couple of years is we've moved away from a personal statement to short answer questions. Encore probably mentioned that. And I tell students that really now is very important as a part of the application. And we're really looking to build a diverse class, a class with lots of different interests and backgrounds and strengths. And so we're looking to those short answer questions to learn more about our applicants. So I tell people to focus on that. And then, I think there's always a lot of uncertainty and concern about virtual interviews and how to present yourself on virtual interviews. And I tell our students that's it's a practice skill. So, you want to practice doing a Zoom interview and, doing it with your friends or your mentors and looking into the camera and sort of all of those things that seem somewhat artificial, but actually allow you to create connections on Zoom. And I think, having now done it this way for a couple of years, we feel like we really are getting to know applicants that way. And really what we're focusing on is making sure you get to know us.
So Encore, you mentioned this in one of your slides, the ICANN triangle or that you posted, but I'd love to hear more about ways that your program is working on addressing issues related to DEI and how to encourage students from diverse backgrounds to consider coming to our residency program.
Yeah, thank you for that question. I think the first program that I would highlight is a program started by Sila Bal and Nicole Singh, two of our residents. And the idea there was to develop a near-peer program to mentor Harvard medical students who identify as underrepresented in ophthalmology. And so we reached out through this office and offered that opportunity to our local students to come by and say, we'll pair you up with one of our residents, and one of our residents will be your mentor to take you through grand rounds, for example, to bring you to clinic, to bring you to the OR, and to also give you an opportunity to get involved in a case report or some research. And that program started out with 3 or 4 students and has now grown to about 8 to 9 students per year. And it's a great way to get early exposure, whether those students end up going into ophthalmology or not. Having that connection with someone that's just above you is really nice, and vice versa. We all know that we learn from our trainees as faculty members, and that's part of the reason that we stay in these academic situations. But I think having that opportunity as a resident to be that teacher, that mentor, maybe even that sponsor is really, I think, valuable in any program that you go to. So I would look for those opportunities. But I think the lovely part of that is that was a resident initiative, and it's really taken off. We have others that you can get involved in, and some of them are on the college level, for example, recruiting students at Harvard College and MIT and giving them ideas or thoughts of what it might be like to be in medicine, to be in biomedical research, to be in ophthalmology specifically. And our residents have definitely gotten involved with that. And it's, again, another opportunity to teach, mentor, and sponsor.
Thank you. And Lori, one of the things that's great about these webinars that we do is some students that are watching this are on the verge of entering the application cycle, where other students are maybe second or first year medical students who are starting to express that interest in the application in ophthalmology. I guess my question for you is, how do you decide if ophthalmology is the right specialty for you? And what tips do you have for students to figure out how, if ophthalmology is the career choice for them?
So I think one of the things we all love about ophthalmology is actually the diversity of it. So ophthalmology just spans so many different things. And so I think you can have lots of different interests and fit in this field. For example, we have pediatric ophthalmology. So Encore is one of our pediatric ophthalmologists, is seeing, newborn babies. And then I'm an adult ophthalmologist and I see people who are over 100. So you have that sort of span of ages. We have A lot of, it's a surgical field, so there's a lot of surgical opportunity, but it's also medical. So we treat infectious disease, we treat inflammatory disease, uveitis, for example. People specialize and are spend a lot more time sort of doing medical ophthalmology. It's a field that has a lot of applications in public health. Blindness due to cataract is the leading cause of blindness worldwide, and that's something that we know is treatable. And there are a lot of different interesting opportunities to be involved in global health in ophthalmology. Our residents in our program have the opportunity to go to Aravind Eye Hospital in India and see how care is provided in different setting. And then there's a lot of sort of technology and devices. And so people who are interested in that and sort of advancing technology and imaging and engineering are often interested in ophthalmology. So I always say there's something here for everyone. And then the way you have to figure it out is by engaging in it and seeing it. So making sure you're doing rotations as a medical student in different areas, and finding mentors and asking honest questions. I think sometimes our medical students can be hesitant to ask the questions they want to ask. And I think from our side, we're happy to answer those questions. So feel free to ask, your mentors and people that you shadow and spend time with, what their lives are like, what they like about their jobs, what they don't like about their jobs, what opportunities they found, what they were surprised by. It's fun for us to talk about those things and what we like about what we do. And I think we tend to be sort of honest and candid. And I think people shouldn't be shy about asking those questions because it's a big decision.
Encore, I want to go to you because you mentioned this with one of your last slides about it being an all Harvard residency program with training at various hospitals. Can you just talk about Mass Eye and Ear's relationship with the other hospitals and how sort of the residents may flow between the different hospitals and get exposures from the different settings?
Yeah, so Mass Eye and Ear is obviously our flagship. It's like sort of our fleet commander, if you will. And we all have a link to it for the most part. And so the vast majority of your training as a resident will occur at Mass Eye and Ear, sort of within that building or buildings actually nowadays, both clinically and surgically. And then you will have rotations that will take you outside of those walls to Boston Children's, for example, to Beth Israel, to our VA hospital. And as you can imagine, each of those settings is going to have a different patient population. I mean, it's pretty easy to say that Boston Children's is going to be pretty heavily focused towards the kids, although we do see some adults with congenital type of problems that go into the adulthood. And you're going to see lots of veterans at the Veterans Hospital. And so you get that diversity of patient groups as well as you move around these different hospitals. The program itself is quite seamless. So in other words, we try not to make you cover different hospitals at different times and try to keep you in one place so that you can maximize your learning and minimize sort of travel across town or shifting between systems, which we all know is mentally taxing and probably inefficient. And I think that many of us have sort of over the years worked together. So I think Joan Miller, I mentioned earlier, is our chief, and Dr. Miller really had this vision of creating Harvard Ophthalmology. And she has partnered with all the chiefs at the different hospitals to ensure that our teaching, our research, our clinical care is all aligned and moving forward. And that comes through education retreats, faculty retreats, research centers of excellence, where we're all conversing with each other. And so I think that's one thing that she has had a vision of doing that has really revolutionized how I see our department from when I started, where it was a little bit more independent to where it was a little more sort of interdependent and synergistic. And I think I'll give one last story and stop there. The pediatric ophthalmology services, obviously near and dear to my heart, are totally integrated. So I have clinic and OR over at Mass Eye and Ear, and today I'm at Boston Children's Hospital. We also cover Beth Israel, Brigham and Women's, because there are little babies that are born there, and we need to check them. And as a resident here, you will be part of our team, and you will be going to all those different areas with us when you're on rotation.
Yeah, if I can add, I would say I think that's one of the best sort of things about being Harvard Ophthalmology is just sort of the diversity of locations also leads to a diversity of patient populations. And we're increasingly trying to get involved even more in sort of community health. And as we integrate into Mass General Brigham, we're taking advantage of working with community health centers and bringing ophthalmology there. So I run a program where we do diabetic retinopathy screening in community health centers, and there's opportunities for our residents to go and volunteer there and to work there to learn more about community health. So I think the sites continue to expand as we have opportunity to do that in our system.
So for those students who, again, may not be in that application process just yet, they're second year residents about to be third year. Can you talk about what you're looking for when you're assessing students, when you're doing your reviews of applications of students' performance during the third year? Are you looking at their clinical evaluations, whether it be surgery or medicine? What are you doing to assess students from a medical education growth perspective during that second and third year of medical school? And I'll pass that to you, Alice.
Yeah. So we do spend a lot of time looking at the grades and assessments, to the varying extent that they exist at different medical schools from second and third year, and really trying to understand how people performed on their medicine rotations and their surgery rotations, and others in sub-Is as well. And the things we're looking for are teamwork, signs of someone who's able to sort of incorporate feedback and develop over the time that they're there. So you don't have to, I tell it to my residents too, that you don't have to know everything and do everything perfectly when you start. What we're looking for is people who are looking to grow and looking to sort of overcome any obstacles in their learning and show that they can do that. And so that's one of the things that we really focus on. And I think, our advice to medical students is always just to put your effort really into those rotations, really get to know your mentors there and sort of put your kind of full effort into perform there, because we are really looking at that. I don't know, Encore, if you have anything to add there.
I think that's the major thing. We want to see that you're all in whatever you do, because I think that will show us that you're all in when you come to us as a resident. And as you go through each of the ranks, there are different sort of diverse educational opportunities. And there is, as a medical student, there is clearly something to learn from psychiatry, even if you are going to be a surgeon, and vice versa. And so I think as you get to the residency, there's clearly something to learn from pediatrics if you're going to be a retina specialist, or from cataract if you're going to be a uveitis specialist. And so we want to see that all in as a sustained approach, because as we said, we want to train you to be the leaders and to drive our field forward. And so that over time needs to be built up and practiced, if you will.
Yeah, and I think demonstrating that you take advantage of the resources that you have. I mean, different medical students in different places are exposed to different things. And some people come from places where there are huge ophthalmology departments and a lot of research opportunities. Some people come to our program from places where there was not an ophthalmology department. And so that doesn't matter as much as really taking advantage of the resources that you have. I think one of the things that we think is really special about our program is the resources that we have here to provide our residents. And we really are able to support people in whatever goals they have, whether they want to work in public health, or if they want to be clinician scientists, they want to be clinicians or educators. We have mentors and resources to sort of start people's career off in all of those things. And so we just want to make sure that we have people that we're training that are going to take advantage of those resources.
So one thing that we're known for with our visiting clerkship program is the fact that we bring students to our campus and get to do rotations with us. Can you talk to us about the value of away rotations specifically for ophthalmology? And if there is value, which I'm assuming that there is, when is the best time for students to come sort of in that academic year? And what are you looking for when students have those experiences when they come and rotate with us?
Start. So I think ophthalmology is really hard to rotate in. So I think that you should recognize that we know that it's not the same as if you go to a medicine clerkship elsewhere and you've already done your medicine and you're trained and you know what to do on day one. Ophthalmology is hard. It's, as a med student, you're often observing. It's hard to be as involved in the same way that you are in medicine and surgery. So we are aware of that. And I think we are looking for people to come and to be interested and enthusiastic, to read ahead of time about some of the cases they're going to see. When you show up at our clerkship, we'll give you a schedule and you'll know where you're going to be each day. And so you want to read about those specialties and have an idea of kind of what questions you can ask. But really enthusiasm and engagement is one of the biggest things that I think you can demonstrate on ophthalmology rotation. And I think away rotations are valuable, particularly if you want to go to a certain area of the country that demonstrates your interest. I'm sure Encore mentioned this, but we get 800 applications for our program for 9 residents, and we have to figure out who we're looking to recruit, but also who wants to come to us. Because I really believe that you wanting to come to us is just as important as us recruiting you. And so one way that you can demonstrate your interest is by doing these external clerkships and going to programs that really interest you. But it's really a matter of coming and being enthusiastic, engaged, and asking questions. And we're looking at that and sort of the rapport that you have with patients when you're with us. Or anything I missed?
And I would say this, that when you do go on ophthalmology rotation, whether at your home institution or at our institution, the way to show that enthusiasm is really to prepare the day before. So pull up the charts. Go through those charts. It's tough because ophthalmology is fast paced, especially on the adult side, 45 to 50 patients, perhaps in a session, sometimes in a day, but perhaps in a session. And spend those 20, 30 seconds going through those charts and at least knowing sort of some basic information. And then you'll see a repetitive nature. The first day, it'll take you forever. And then as you get through the rotation, it'll take you less and less time. But then you build this sort of pedestal of knowledge when you walk in the room with your preceptor, where you're not sitting there and learning that John Smith is here because they have a cataract, but instead that John Smith is here because they have a cataract and perhaps they have pseudoexfoliation, which is a disease that makes cataract surgery more difficult. And now you can have that conversation with Dr. Lurch about the surgical considerations. And that enthusiasm then shines right through. And those are the things that you can't learn from a textbook or reading the chart, is the experience that surgeon or that medical ophthalmologist may give you in that clinic time or time.
Yeah, I think getting involved even outside the clinical experience, most places that you rotate will have opportunities for research. So you can ask, if you've seen an interesting patient, you can ask a mentor whether you can write a case report, or you can even ask people you're with if they have any research projects that you can get involved with. Similarly, whether there's any community health projects or outreach projects, and we have opportunities for students when they rotate with us to get involved in our community health work. So asking sort of what you can get involved with to understand the field better outside of the clinical work, I think is really useful.
So, it sounds like from your perspective, away rotations are extremely valuable and helpful for the application. And we would encourage all students to apply to the visiting clerkship program if you're interested in rotating with us. And I'll post some more information up on the VCP later towards the end of this presentation. So thank you for helping us pitch the VCP and encouraging students to come and rotate with us. But unfortunately, not everybody can come, not everybody can join us. We know that away rotations are great ways to learn about a program sort of from that inside out. But what are ways that students can identify if this program is right for them? And, Alice, you were mentioning about sort of, doing your homework and reading up, but it's often difficult from that arm's length perspective. And I would say more importantly, there's a lot of misinformation that's out there on some of these blogs and websites that are out there. So how can they best learn about your program or any program when it comes to ophthalmology?
Yeah, so we've been really pushing the last couple of years to do a better job with transparency. A few of us wrote an editorial a couple of years ago about the need for transparency, and so we've started posting a lot of sort of our statistics and numbers, and we've increasing numbers in videos and webinars and ways that you can sort of get to know our faculty on the website. So that's always where you start, right? Is looking through that material. I think, what we've done in the past, and we're always happy to do, is set up interested applicants with our alumni. And so we've done this over the past couple of years, and people have reached out given, set them up with people who are perhaps not even faculty anymore, but came through our program, over the past couple of years, know it well, and can talk to applicants, particularly people who have shared interests. I think one of the strengths of our program is we have this massive network across not only the United States, but the world. And I think that's one of the biggest assets of coming here. But that's something you can tap into even before you come here. If you want to learn more about us, we're happy to set you up to talk to our alums and learn more. I think you do want to be wary, and I think you were alluding to this, you want to be careful of sort of where you're getting information, because programs change, programs are dynamic, hospitals are dynamic. And so you don't want to get all of your information for someone who trained 30 years ago in a certain program. There's a certain amount of accumulated knowledge, obviously, for people who've been in the field for a long time, but what your day-to-day life is like might be very different now. So going to young alums, I think, is a great way to get that information. And we, for one, are happy to set people up to have those conversations.
So Encore, you mentioned that there was a change in the application recently. We talked about the videos no longer. I believe Alice mentioned that moved away from personal statements to more short answer questions. So it seems like there's some changes that are happening in the application. I think one thing that stays pretty constant is letters of recommendation. That is something that's really valued. Students, as they are getting that application ready, and right about now, they're probably asking for those letters of recommendation. Who should those letters be coming from? What do you like to see in those letters, and how can students help their letter writers be best suited and best prepared to write a strong letter of recommendation for them?
I think there's quite a bit of debate in this field as well. And so I will give you my answer, and then perhaps Alice might give you a slightly different answer as well. So I think that every letter reader perhaps is looking for something different. And so it's very hard for students to understand exactly, how to navigate that whole field. I will tell you, for me, what I like to see is those letters come from people that really know you well. And the reason that is because the anecdotes that are in the letter are really those things that resonate with me as the reader. Those anecdotes show me that, we talked about this earlier, that you're all in, that you are a leader, that you are developing programs that are going to advance medicine in general, or just society in general. And those things shine through by people that really know you. And so I think that's the most important thing. First, find 3 people. There are 3 letters of recommendation that really know you. Second, for me, I really like to see one of those letters of recommendation come from a core rotation, because I feel that you shine as a doctor and as a physician in those core values that we teach across medicine and surgery. And so I really want to see how you function as part of the team, as an integral part of the team, as a sub-intern, or as a medical student who's really actively taking care of those patients. Because again, the same thing's going to happen when you get to our residency program. You are going to be an integral member of the team and taking care of those patients, and I want to see how you functioned. So that's one letter of recommendation for me. I think the second letter of recommendation obviously is from our field, and someone that you've rotated with clinically. You are applying for a clinical position. And so we want to see that you've performed very well in clinical ophthalmology, clinically, surgically, whatever you can get. Alice alluded to this a little earlier, that it's a little bit more of I like to call it a spectator sport, as opposed to a participative sport, because, it's the examination is totally different from what you've done. And the diseases are totally different than your base education in medical school. But there are ways to shine, as we alluded to earlier. And I want to see that coming through in that ophthalmology letter. So then your third letter is, for me, that wild card. And so if you have taken a year off, or if you've done a PhD, I think it's pretty easy. It comes from that person that is your mentor for that significant extra experience, because again, they're going to bring something else to the plate to let us know about how you are going to perform into the future. And because we're investing in you, just like you're going to invest in our program, we are interested in developing you to be that leader. So I think that's easy in that third letter if you've done that significant experience. If you haven't, and that's okay, you don't need to do all of that stuff. I think that second letter comes from someone with whom you've done a significant project. And if that's in ophthalmology, I think that's great. Some sort of scholarly, for a program like ours, I think we are really looking for some sort of scholarly activity. And so scholarly activity doesn't necessarily mean bench research, doesn't necessarily mean clinical research, but some sort of project that you've brought to fruition that is going to add to the field and that really informs what you're going to do into the future, so that I can see that thread that you're sort of developing in yourself, so that I want to turn around and invest in you. So I think that would be my letters of recommendation advice to all of you.
And I just want to follow up with a question that sort of popped into my head as you're talking about, if all students may have taken a year off or did a PhD. One thing that we're seeing, especially in some of the other specialties, in particular orthopedics, is really a strong drive towards students doing a 5th year of medical school for research or whatever it may be. Is that a trend that you all are seeing in ophthalmology? And sort of for those students who aren't taking that 5th year and are going to do 4 years of medical school and apply, is that a drawback? Is that a concern that students should have?
I don't know if I would say it's an increasing trend. I think it's been existing that way for a long time. My guess, and this is totally not data driven and just a gut feel, is maybe a third of, maybe 20%-ish of our applicants, I would guess, have taken that extra year. Encore, you can tell me if that seems totally off base, but I think that's stable. I think that's been the case. There are pros and cons. If you do a year off, you want to make sure you have something to show for it. And I shouldn't say off, you do a 5th year, you want to make sure you have something to show for it, right? So you want to, if you've done research, you want to be able to show the research that you were working on. You want to have something that's in at least either published or in preparation for being published. And a letter, like Encore said, from your mentor about what you did with that year. And so a 5th year is a great opportunity to do interesting things, but it's also a time that we're going to be looking at to see, how you use that time. And on the other side, I think if you decide not to take a 5th year, that's fine. You're in good company. It's not that everyone is doing it. And our expectations are different. So we do like to see everyone who's done some sort of scholarly work and engaged in some kind of research, but certainly when we're looking at people who haven't taken a 5th year, we don't expect as much to be completed. My general advice is take a 5th year if you're interested in it. Like, only do it if you want to do it. If you find something you're really passionate about, this is a great opportunity. We can tell you there's not that many other times in your life that you get to take a 5th year. And so if there's something you want to do it, but do not feel like it's something that is a necessary part of your education or a necessary part of your ophthalmology application. That's certainly not the case for the people that we're accepting.
That's a great point. There's not too many exits once you get into once you get past medical school and get into residency and fellowship and practicing. So if there's something special you want to do, this is probably a great time to do it. A couple of years ago, there was a big wrench that was thrown into some program directors and some medical students' lives when step 1 became pass fail, and students now had to focus everything on step 2 because they were concerned about a score. And I just would love to hear, Alice, your thoughts, or Encore, your thoughts about sort of how you all emphasize the holistic review of the application and to help students not be so focused on a single number score as sort of the gatekeeper that's going to prevent them or allow them to pursue ophthalmology as a career.
Yeah, so it's tough. I mean, but it's been a tough, and as you said, it's been a transition for us all to really think about how we look at applicants. But I would say I think the effect has been exactly the intended effect, is that we look much more holistically now at applications. We were never using step 1 as a cutoff, but it was always part of the conversation. And over the last 2 or 3 years, we just sort of stopped making it part of the conversation, test scores overall, because they weren't as available and because we wanted to really figure out how we were going to do this in a more holistic way. And so we in our program have all applications get read by 2 of our faculty members, but we now have workshops for all of our faculty members where we talk about the different components of the application and how we really are looking at short answer questions, journey traveled, potential for leadership, and clinical clerkships sort of in a more sort of equal way, sort of all of those categories we're looking at and putting weight on them. And we train our readers to do the same. And, you know, in terms of step 2, people ask a lot, you know, do I need to have a step 2 score? And I think overall it's sort of being de-emphasized. People are not looking at step 2 the way that they were looking at step 1. And so if it fits in and you can do it, then I think it's good to have if you do well, but I wouldn't say that we're looking at step 2 as for any kind of cutoff or sort of indicator of whether we're taking your application seriously. We're much more thinking about all these different components in a better weighted way than we were before.
And a question for you, Encore. Or Encore, did you have something else you want to add before I go to?
I was just going to very quickly add that the national conversation is also very similar. It's like, what do you do with step 2 scores? So it's not just our program, but I'd like the students to know that all these programs are grappling with this. And so, you know, try not to worry too much about it, because there's worry on this side as well. Like, how do we do this in a way that is going to really make a match? Right. And that's in the end what we want. We want you to be happy with where you match, because you're going to perform great. And we want us to be happy, because then we can develop you and invest in you and make you the next leader for our field.
Yeah.
Encore, I'll stick with you. The interview process, in person for forever. That's all we knew. Then the pandemic happened and we switched to virtual, and it worked out okay. You know, how is my assumption is that your interview season is going to again be virtual. Any thoughts on how students can best prepare for those virtual interviews?
Yeah, I think Alice alluded to this earlier, but practice. You know, it's great that we're now sort of post-pandemic, if you will, and I guess we are post-pandemic at this point. But all of us have learned over the last 3 years how we can interact over Zoom, and how we can, you know, make eye contact with the camera instead of looking down, and how we can have, you know, uncluttered backgrounds and really sort of be professional in Zoom. And so I think practicing is one big component of it, but you've already practiced, I'm sure. The second is that there actually is a growing body of literature on how to present yourself on camera. And I would encourage you to read it. Go into other fields, into business, into marketing, and pull up some of those papers and just very quickly read them. And then the third is that I'm sure Harvard does such a beautiful job of supporting our students, but I'm sure that your medical school does a beautiful job of supporting you as well. We have these practice interviews, and I've really loved sort of seeing our students go through those with our faculty members. And I think that's a great way to get going and to start practicing sort of being natural on the camera and coming up with answers and making eye contact and these sort of extra movements that we do that sort of make us engaged with the speaker.
I would say too, it goes both ways, like everything else we've talked about. I mean, it's something that we struggle with on our side too. You know, we're here trying to showcase our program and connect with you, and that's much harder to do on Zoom. And you know, we look at our feedback every year, and sometimes people say that we seemed cold, or we seemed distant, or we seemed awkward. And you know, I would say that's not across the board, but you know, I think it's the case of sort of all faculty. Like, we're trying to figure this out as well. Basically, we're trying to figure out how do we engage the same way on Zoom as we used to do when we were there with you in person in the room. So don't feel like you're alone in that. We're kind of also working on that and trying to connect.
And I will toss in a shameless plug for some of the work that we've done with the DICP. We have 3 videos about living, working, and playing in Boston that are available on the DICP website. And they're actually from the perspective of current, or I'm assuming for some, since we did them a year or 2 ago, past trainees. But they talk about what it's like to live in and around Boston, where they go for, you know, their social time, where they go for when it comes to their faith and religion practices, where they go to eat. But then they also talk about what it's like to be in the hospitals and the neighborhoods that they serve and the communities that they get to engage with. So check those videos out. We left them up online. I think they're really cool, really insightful, and we'll make sure to have a link to that as a part of our email out that we send to all of our participants. Another question for you all related to the interview process, but maybe that post-interview process. And I'm sure you've gotten many nice handwritten letters or cards from students. And I know some schools really encourage this, and other specialties are starting to, discourage that practice as that extra level of pressure for students. Where do you all land on those post-communication interactions with programs after the interview?
So I make it part of all of my presentations on interview day to say, do not send us any thank you notes. You guys are busy. You have a lot of programs to visit. You have a lot of work to do. You're medical students and trying to juggle applying. It is, you've already expressed interest by joining us. We love getting to know you, but you don't have to write us thank you notes. And you know what? Everyone listens to that. I feel like once I've said that, then I really don't get any thank you notes, and it's exactly what I want. So I don't know if that's true across the country. I think you have to get a little bit of a feel, and you probably have to ask, residents or recent alums from different programs or what the culture is in those places. But I tell people not to send us the notes, and they don't, and that's perfect.
You heard it here. And you'll hear it during interview day. Go ahead, Encore.
I apologize. I talked over you. Please.
No, I was just joking about just reemphasizing this. There's actually a really good question in the Q&A that I want to turn to you, Encore. And it's basically saying that the program obviously is going to be lauded for its research. But what are some of the other program strengths that are often overlooked because it is, considered an academic heavyweight and considered, the Harvard residency program?
I think one of the strengths that I think we have here is one level of care. And I think that's different than some other residency programs. And you really need to look at different residency programs and how they're structured as you are going around the country and interviewing or virtually interviewing, and see which place you fit into. So what do I mean by one level of care? About 20 years ago, our resident clinics were actually abolished. And the major part of the reason that they were abolished is because we saw differential care being doled out to patients and access being different across the Harvard system. And that's not appropriate. Everybody that comes to Harvard deserves, if you will, that Harvard level of care. And that's not any different than the excellent care that everyone else is providing. But I think it's really critical. And so I alluded to this in the earlier presentation. You are part of the team. And I really value the input that we get from our residents and our fellows in terms of how we're taking care of the patients, because they see things that I don't. They may be able to communicate with the patient better than I do. And I think that is something that is really special here and very important to see. And I don't think that it sacrifices your education. I actually think that it amplifies your education. And the best example I'll give you is that, I recall very clearly early in my surgical training where I was operating with one of our attendings on cataract surgery, our basic bread and butter. And she told me, she's like, look, the reason that you can't keep the eye straight is you're not bending your wrist. And she told me that in 1 second, and I haven't forgotten that 15 years later. And so I make that mistake once, and then I fix it. And that's better for our patients. And then I can move on to the next step that I need to learn.
Could I add one thing too, which is I think the diversity of pathology. We are a research heavy program, or where we're known for research at least. And, there's a lot of other things that happen beyond the clinical care we provide. But I think the clinical diversity, the amount of pathology you will see here is really unparalleled. And a lot of that comes through our emergency rooms. So there are 3 eye emergency rooms in the country, and we're one of them. We're open 24/7 for eye care. And that's where it just came from. But, I basically, it's a busy place and it's a lot of work, but I really think, I can look now at an atlas at ophthalmology, and there are very few things I haven't seen of all the, rare diseases and uncommon things, because I've spent so much time in that emergency room. And really things come from all over the world. People get off planes from other countries and come there to get a diagnosis from our residents. So I think that's something that's really unparalleled in other places.
So this question is really now for the students, and just helping them to think through what happens after the interview and setting up their rank list. And, obviously we want all of the students to rank us number one, but the reality is students will find different reasons to rank different programs. And so how do you encourage students to go about and come up with an approach to ranking programs so that they can end up in the program that's going to help them to thrive and become the ophthalmologist they've always wanted to be?
Maybe I'll start off, and Alice, you can jump in. I think the first thing is probably that gut feeling. There's nothing better than a gut feeling. I think that if you get that gut feeling that this place is for you, it probably is. And I think there's so many little intangibles that come into the interview, how you're reviewing the website with the data, what your preferences and maybe even biases are going into the approach. I think those are important to validate and to say that it's okay that I like this program over another program. So that's number one. I think your gut is really, really good. I think the second is look at yourself professionally and where you want to go. And I think this is important for the application because it gives the reader also an idea of where you're going. So it's a great way to present yourself. But look at where you're going professionally, and then look at the program and see if you have role models and mentors that are going to help you get there and opportunities that are going to help you get there. And then third is personal. And I think all of these three things, I put them 1, 2, 3, but I don't mean them in rank order. I just mean them as sort of across the board. Personally, do I see myself living in Boston with cold winters and lots of snow? And maybe you do, and maybe you don't. Maybe you're from Alaska and this is like sunny heaven. But look at those personal pieces of life. Can you get home to your family easily? Can you see yourself living near the harbor like it is here? And put those things and weight those appropriately for what you see in the future.
And then from a practical standpoint, this is something I don't love about our process, but it's the reality of our process that most programs will expect you to tell them if you are ranking them first. And, it's not the way I think it probably should be set up, because I think it puts the med students in a difficult position, but I do think places take it into consideration. And so, it's something you want to think about, talk to your mentors about. If you have someone who can reach out on your behalf and tell the program that you're ranking them first, a mentor can do it, but you should also, if you don't have a mentor who can do that for you, you can do it yourself. Make sure you only tell one program that, because ophthalmology is a small field, and so you don't want to tell more than one. But for better, for worse, that is sort of an expectation, and it's happening, part of the culture of our application process.
With that, I see that we're already at 1 o'clock. And so I want to say thank you to Dr. Shaw and thank you to Dr. Lorch for joining us. Lynn, do you mind putting up our last slide so we can just go over some other information about our visiting clerkship program? So these are dates if students are still interested in rotating with us. There's a little bit of time if you want to come and rotate with us in September to get your application in through VLSO and VSLO and the visiting clerkship program. Oops, excuse me. And if you want to come in the months of October and November, you have a few more months ahead of you. Next slide. And other webinars that we're going to be hosting are going to be on the left, the orthopedics program, urology, and physical medicine and rehab, as well as our webinar, our in-person visiting showcase, which is going to be Saturday, September 9th. And with that, we will put up this very brief survey. Please fill it out. And we want to say thank you again to our ophthalmology colleagues, Dr. Shaw and Dr. Lorch, for joining us, and for all of the students joining us. Enjoy the rest of your day. And Dr. Shaw did post his contact information in the chat if you want to reach out to him directly. With that, everyone have a good afternoon.